you. So let's take a look at this first category. What is going to happen to your premiums if you have insurance through your employer? And most Americans who have insurance have it through their employer. If that is your situation, your premiums, what you pay on an annual basis for your insurance, are going to remain approximately the same according to the Congressional Budget Office. But now take a look at this. If you're someone who buys insurance on their own, you don't get it through your employer, and if you are making more than $88,000, your premiums will likely go up. And now let's look at our third group here. If you are getting insurance on your own, not through your employer, and you are making less than $88,000, your premiums are likely to go down because the government is going to be subsidizing your premium. So that's sort of the crude breakdown of how this is going to work as far as how it affects your wallet. Allie?
Roland, folks you're speaking to, is that working the way they would hope that it was going to work?
Well, again, I mean, you have people who are saying that who's going to pay for it. You also have folks who are saying that, look, taxpayers, especially those who are making more money, are already paying for health insurance. When you look at the rising costs in cities and counties,
right,
when they jack up sales tax and property tax to cover the uninsured who are going to county hospitals. So
right,
the question now is, will county governments have to increase taxes as a result if Americans are now going to be covered? And so, look, you're paying either way.
Remember last summer when I was in Chicago and you sort of hooked me up to talk to people about health care? One of the big issues in Chicago was, like you said, emergency rooms that are being used by people for regular course of health care because they didn't have the insurance
right,
that would have allowed them to go to a doctor. Elizabeth, do the provisions of this bill, by helping more people get health care, mean that we are likely to see an increase in pressure on emergency rooms or a decrease?
Theoretically, it would be a decrease, and here's why. The way it works now is that if you don't have insurance, you're going to show up at the emergency room, just like you said, Allie, for really basic kinds of things, because you know that they have to take you. They are not going to turn you away. So if all of a sudden these 32 million people have a regular doctor, just a regular family doctor to go to, then they won't need to go to the emergency room, which, one, clogs up emergency rooms when they go there, and two, emergency rooms are expensive. You don't want to go there because you have a sore throat. It drives up the cost. So theoretically, this will decrease wait times in emergency rooms. Those wait times have been going up over the past couple of years.